Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to Okay. There's also a question like this. What the topics in the master, what kind of topics will be covered in the master? So actually, you have answered this question before. It's all of the field of dentistry will be covered in the master, such as periodontics.
More or less. Ask to this guy what topic would you ask. He will type. Please type the field that you would like to know, and I will respond exactly what you would like to receive.
Okay, actually, this laser program covered all of the topics, all of the field in dentistry.
But he's not typing.
No, I'm answering. I'm answering the question also.
Okay, so we cover dentistry for children. What means caries, pulpotomy, pulpectomy. So hard tissue therapy. We cover we cover soft tissue therapy for children, frenectomy, lingual, labial, or gingivectomy or tumor removal afters. We cover endodontics. Endodontics from pulpotomy, pulp capping to root canal disinfection. If you have an nervium, we suggest one type of therapy. If you have only a diet, we suggest what a diet can do. But it's important to know the difference between the laser, because you must have the motivation to upgrade your technology. We talk about the conservative dentistry from tooth desensitization up to cavity preparation. We cover the perio topic, from the pocket disinfection to the mucogingival surgery,
the pigmentation,
or to periimplantitis. Very important for periimplantitis. If you put a lot of implant, you cannot, it's impossible, don't have a laser to manage the 5-10% of failure that unfortunately we have. So it's very important. You cannot do implants without a motor for putting the implant and for a laser to manage the periimplantitis. So, very good. And then if you have photobiomodulation before and after surgery, you accelerate the healing. If you have the photobiomodulation, you accelerate, for example, Invisalign. Why not?
Yeah.
You know the treatment.
Yes. Like facial aesthetic, maybe also.
Yes. We have lean lung here.
Yeah.
Facial aesthetics. She's a master. She's really a master. She has not only the degree, but she's very skilled in doing facial aesthetics.
She will be my guest in 2 weeks for talking about laser and facial aesthetics.
Very good.
So actually, it covers all of the field of dentistry, definitely. In my experience with the group, with ALD, and also with Unicatt, with here, Professor Olivi as the director for the program. And the question is about practical course. Well, you get some practical course with the International Fellowship of Academy of Laser Dentistry also. At that time, I was doing the practical course in UAE, in Dubai, in Ajman University with Dr. Manaf. He is the coordinator in the university there. Well, hopefully we can, do this with ALD Indonesia in Indonesia for the Southeast Asia. Hopefully. And
Yes.
also there's another question. Sometimes in the region, the master degree is not acknowledged. For instance, like Indonesia. The question is from Indonesian doctor, I guess. This master is not what do you say, accredited by the Indonesian Ministry of Education and something like that. Well, it's not just Indonesia, maybe some countries also.
Yes, but this is for all the education courses from university. Not all the country recognize education from other countries. But also if it is not recognized, is a university title. It's not a piece of paper.
Yeah, it's not just some certificate. Well, it's acknowledged by...
It's a university master.
Yeah, it's acknowledged.
The world is big, and sometimes we are not able to manage. For example, in Europe, we are able to recognize our degree.
Yeah. It's recognized by the European Union, right?
Yes, absolutely.
Okay, so from my experience, we have some very well-known speakers from around the world in your program. So, will that speakers changes every year, or will the lecture will be the same?
We put some new speakers inside the program, so we will have surely three new speakers. Probably I will invite some guests to talk about a specific topic, so something new. Probably we will have also one very good endodontist, new speakers in the program. So if it's possible, we improve the group of the speakers. But I can say that, I said at the beginning, I need another week to have other 12, 14 speakers. But then the program starts to be too heavy, and it's difficult to travel as you did 4 times in 1 year
Yes.
in another country so far.
Yeah. So from my experience following the program, you are preparing the students to become teachers, if I'm not mistaken. How you do that?
One, it depends on the student. If the student is the sum that is 58, 59, and is already skilled, and is so skilled that he wants to know more, he's automatically a professor. And so it's automatic that if I met this guy that is 59 or maybe now is 60, I will invite him to join the group for his specific. I'm talking about Phil M.
Yeah, Phil.
For some younger, I think that they have to support the group 2, 3, 4 years and grow more, like you. And in 3, 4 years, one can become a professor. So it's important. It's important to be in the group, to exchange ideas, and it's important to have also a leader, a director that is open-minded
No, that's
that is open to accept the invitation to change something. I am always open to change mine. If something's wrong, it's important to change.
There's some problem regarding this, I'm quoting what you say about open mind. It's not easy, sometimes. And for instance, in a country that teach like periodontics in the field of periodontics, they say, for instance, like I found new things with laser. For instance, like this, in the field of periodontics, they were taught that you cannot do crown lengthening without opening a flap, right? And it's become more like a doctrine, for instance, like that. But nowadays with laser, we have proof in the laser field that crown lengthening can be done. I mean, with a closed flap. For instance, like removing like 3 millimeters of bone, something like that. So it's going to be like contradiction to what they taught in the conventional dentistry and with the laser dentistry. Because not easy to be open-minded as a professor. Maybe there's not so many people like you.
We know this topic, crown lengthening, was one of the topics that in 2006, I present in Tucson for my advanced proficiency in erbium chrome and white speech. I present one crown lengthening case. And when we have a teacher, because he's a teacher, as a walid, that show you step by step when there is the indication and when the indication are not present to do one treatment or another. This is the goal. We have different tools. If in some case we can use one tool instead another and wait 3-6 months, why to do not choose this tool? And this is for the professor. But when you know very well the literature and you understood that in periodontics, the use of a laser is something more that you use. Yeah, we were talking about periodontics.
Yeah, periodontics.
The periodontics say, no, the laser doesn't work. It's not true. If you read the literature, all the literature papers say that after 1 month, the laser group is always better. In some paper, after 3 months, the laser is still better. In most of the paper, after 6 months, laser and conventional are the same.
Yeah,
this is something very specific. That if you understood, okay. But if you have not understand, if you don't understand, you need the professor that put in your mind why after 6 months all is the same, what you have to do at 3 months. There is something that we can do.
Yeah, but I think it's not easy to be like to have. There's not so many people like you. I mean, the professor of the university to have such open mind like you have.
And this is why, thank you. And this is why I hope to have other 12 or 15 students next year in my course. The registration are already open. And there is also written English version. So if you go English version, you can find all the information for registering. This is why.
Yeah. I mean, I know that. I mean, yes, I will help if there is some participant that would like to know more about the Master of Science in Laser Dentistry, the Università Cattolica del Sacro Cuore di Roma. Sacro, Sacred Heart. Yeah, I will definitely share with you all of the participants here and also watching us live in Instagram. Just text me in the number that you have for this Zoom registration, and I will gladly help you to reach more information about Academy of Laser Dentistry and also the Unicatt Master of Science program in Laser Dentistry. So there's another question about periodontics related. Periodontics. There's a lot of people that love periods. What about the pigmentation, the peeling of the gum? So I think it was covered by Walid Al-Tayyab at the time in the master course, and also some by Mana Falaga. Yeah.
Yes, this is a topic that is more a topic of your country and the Middle East area, because the color of the skin and the mucosa. There are no other device that can change the color of the mucosa as of the skin. There are no other device.
Yeah.
The same thing, if you do a tattoo, there are no other way to remove tattoo than a laser.
Yeah.
Not dramatically. And so to have a laser that work on the pigment, that is the melanin, or the work on the superficial layer of the skin, this is something that allow you to improve the aesthetic of your smile. If you believe that you need a pink color of the skin.
Yeah, because the conventional way will have a lot of bleeding.
Yeah.
Yeah, and the patient will.
Is it traumatic?
It's a very traumatic. Yes.
Yes. This is absolutely not traumatic or minimally traumatic, and you can do a work very well done. But it's very important to do well, because if you work not correctly, you can have a problem.
Yeah.
This is why we have the best teachers for that.
I have one interesting question for you. This is from the participant that said, there's a journal that said ultrasonic irrigation is better than laser assisted irrigation for endodontics. What do you say about that? It's your field. Come on.
Oh, yes, it's my field. I don't know this article.
it's just the participant just mentioned that, you know, the new irrigation.
Yes. You know that laser activated irrigation is something that you can do with the Erbium family laser.
Yeah.
So if the laser that was used was not the laser that do the sweeps technique or the pips technique, maybe that the results are not at the same level of ultrasounds. The laser are as the car. Also yesterday, Mercedes won. Also yesterday. That means that Ferrari is the same, McLaren is the same, Mercedes are the same. No. In this moment, Mercedes is the best. It's 10 years that is the best. Because inside the motor, something is different. So not all the laser activated irrigation are the same. As not the same are all the 5.
Yeah, my suggestion for the participant who asked this question, you can search in the PubMed, you can search in a lot of journal of Professor Olivi's research. You can see about sweeps for endodontics or
not only mine.
There's
more than 60 papers that validate the superiority of laser activated irrigation using specific device versus other technique.
Okay, there's one more question related to the laser in clinical science. Okay, let's just talk about it. Can laser be used to decontaminate and remove the infection of the sockets? Wow.
Yes.
I think it's, yes,
Very
definitely.
important. Yes, absolutely. The laser disinfects very well. Both near infrared laser and medium infrared laser work very well for that. In different way.
Yeah.
Sometimes the combination of the two wavelengths can work also better. Then it's very important. The laser help with the desepithelialization to prevent epithelial reattachment, so promoting connective attachment, and this is very important that you can do in not invasive way. And then if you have some laser that work with photosensitizers, like the red light, 635, 660, 670, or also the A10 with the indocyanine green. So red light and blue, methylene blue or toluidine blue, or A10 and indocyanine green. You can use the laser for the recall after 3 months or 4 months, not invasive, not expensive, and you have very active disinfection of these pockets, and in 2-3 years you will have the degrees of the depth of the pocket, and this is the way. You have to follow the patient. If you don't follow the patient, there is no tool that works.
I also have this similar question when I interview one little time, also the same, and laser really works on infective sockets. Definitely, my thesis is about that. How to place implant in the infected socket immediately after extraction, removing the infection, place implant, bone augmentation, temporization at the same time. It really works.
And I can say that your thesis, as well as the thesis of Alexandra Crisai, as well as our everyday practice, works 100%.
100%,
really, really great for decontamination and immediate implant or socket preservation.
And the last question will be my question.
Okay.
How to become like Giovanni Olivi in the laser field?
Giovanni Olivi is one of many. It's nothing. I think that you already know the way, because you know how to be imam. And this is what you have to do. You have to follow your way, always sharing with others, accepting a suggestion, you demonstrating to accept the suggestion of follow your path, follow your soul, and go where you want to go, and you can go. If you want, you can.
Yes. Wow. It's a very short but perfect question, a perfect answer. I mean, well, it's not easy. Maybe in Europe is a little bit easy, because laser in Indonesia, I don't know. We will still have a long way to go, I think. Because
the way can be shorter. Start to do something, and we support your work there.
Very good, very good. So before I end this conversation, because we have limited time, can you please, Giovanni, give some take-home message for a dentist who wants to know about laser, who wants to do something with laser? I mean, they have vision in the future that the laser maybe will become one of the highlights of dentistry in the future. So what is the take-home message for, at least for the future students of the Università Cattolica del Sacro Cuore?
I didn't prepare nothing. for
it's just a talk show.
This is more technical. Yeah.
In your opinion,
the idea. I like the concept. Feel in yourself. Feel in your friend that suggests you to do something. Dr. Iman. Follow many short courses. Listen many different doctors. And then start to do something with a very well accredited society or academy. One is Academy of Laser Dentistry. Maybe could be a 2-3 days course, can be a 1 week course, can be 1 year course. And slowly you will find your way.
very well said.
And sorry,
Yeah.
don't follow any manufacturer. It's not the company. It's not the company.
It's the science.
It's the science, always.
Okay. By the way, thank you very much. I mean, this is one way to get the horizon of the field of laser dentistry. And anyway, before we end the show, I would like to inform all of you who watch this talk show live and Instagram at Imankusumadirja, and also you can watch it later in YouTube at Imankusumadirja. Also, next week I will have a closed session. I mean, it's not going to be publicated about the Academy of Laser Dentistry affiliated study club program for all of you who wants to know more about the international fellowship program of the Academy of Laser Dentistry, which will be recognized as the first year of the Master of Science program at the Università Cattolica del Sacro Cuore in Rome. Yeah, and you will be amazed to join Professor Olivi's program. That's for sure. I can guarantee that. You will get a lot of knowledge, benefits, friends from all over the world, and it's well recognized. So I will have it next week, and I will also give you some information about the program, also the Unicatt. So it will be held in English. All of you from the Southeast Asian region, you don't have to worry. So we can provide this session in English. So unfortunately, the time is running out, and it's my honor to be able to interview my Professor Giovanni Olivi. I thank you very much for the bottom of my heart, not just only for this conversation, but also for the guidance, the friendship, and everything that I have received during the program.
My pleasure.
So I would like to say thank you for all the participants here at Zoom. Also, thank you very much for joining us from the beginning till the end, and also for all of you that watch us live from Instagram. So one more time, thank you very much, Professor Olivi. Thank you for talking with us. Grazie mille, ci vediamo. I don't know, next year maybe?
Next time. Okay.
Grazie mille, arrivederci. See you guys. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much. Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to